Hi, Stephanie. Thanks for being here.
Hi, Samantha. Thank you so much for having me.
Yes, of course. So tell us a little bit about you. Where do you live? Where are you from?
Yes, so I currently live in the Eastern Panhandle of West Virginia, about 30 minutes from Northern Virginia and 30 minutes from Maryland. However, I'm originally from Northern Virginia, around Fauquier County, which let's just say is about an hour or so, an hour and 15 from DC. Most people have never heard of Fauquier County before.
That's awesome. So it's still pretty far from Ohio.
Yes, I would say probably an 8-hour drive. We have family in Columbus, so I know we are 8 hours from Columbus.
That's where I'm from, Columbus.
Really? Oh my gosh, what a small world.
What part of Columbus do they live in?
I honestly don't know that many details. I just know they live in Columbus and the drive is 8 hours.
That's all you need to know. I don't live there anymore. So,
You're in Denver, correct?
yes, I am based in Denver. Yes.
Oh, I love that. How do you like living there?
It's amazing. It's so much different than Ohio in a lot of good ways. I mean, for one, just the sunshine here is amazing. Like it really is sunny all the time, except for lately. But yeah, it's been awesome. And no humidity, which is also huge.
That's a big win. My father lives in Phoenix, and if there's just one thing I love about the desert, it's no humidity because here, whoo, I mean, you get a 60%, 80% day and I'm melting.
Yeah, I know. Except it's too hot in Arizona.
Yes,
That's
it
another level of heat.
is.
So when were you diagnosed with diabetes?
So I was diagnosed with type 1 diabetes in May of 2021. So I just recently, as of last month, hit my 2-year diaversary.
Oh my gosh, you're a newbie like me. I was February 2021. So you were just a few
Wow.
months after me.
Right. Oh my gosh. Well, then we're right there, pretty much next to each other. It's been a journey in 2 years. I'm sure for you it has too, but it's like sometimes I can't even believe it's been 2 years.
I know. Were you sick before? Did you have a virus before being diagnosed?
So there's of course speculation of that. However, I was diagnosed in May, and as you know, I think that I may have experienced COVID. I have no way of proving that. However, for my symptoms in retrospect, I think that maybe I did prior to my diagnosis. However, I actually was diagnosed at primary care. I did not go into DKA.
Well, that's good.
Yeah,
I
that
didn't
is.
have to go into DKA. So okay, you don't know if you had COVID because that's what happened to me. I had COVID 3 months right before, and then I was diagnosed.
Wow. Yeah, I've heard, other folks speculating the connection between the two. And at the time I didn't really give it much thought, but thinking back, I'm like, this is very coincidental. The symptoms I was having, and again, I have no way of proving that I did. However, it was very ironic.
That is very ironic. Does it run in your family at all?
No, I am the first generation with type 1. I will say that I was diagnosed at 14 with Hashimoto's, which is hypothyroidism, the autoimmune disease. So I know now that there's a connection between Hashimoto's and type 1 diabetes. However, no family history of either. Lucky me.
So I have hypothyroidism too, but I don't have Hashimoto's. So like what's the difference between the two?
Okay, so the difference is actually really simple: antibodies. I was actually tested to see if there were antibodies for autoimmune as it relates to my thyroid, and they were present. Again, that was I believe, yeah, I was 14. And I remember at the time, some of my symptoms were a goiter in my neck, very enlarged thyroid. And then I was very fatigued all the time. I could just sleep and sleep. And I believe I actually remember that I was in gym class and I was accused by the nurse of wanting to get out of like my middle school, like gym class. And I'm like, no, I'm actually struggling keeping up. And so luckily my parents acted on that, and we discovered my Hashis, and then I was put on a Synthroid regimen back at 14. And it was interesting though, right when I was going into adulthood, my thyroid kind of leveled out. And I mean, I was right above the threshold, so I didn't have to take medication. And then later down the road, type 1 came, and then I got pregnant, and my pregnancy actually exhausted my thyroid completely, I think down to 17%, which was significant. So now I will be on Synthroid for the rest of my life.
Wow, this is so interesting you just said that, because I take Synthroid as well, but this is bad to admit, but I forget to take it all the time. And I never notice a difference, like ever. And I'm like, do I even need this? Like, I don't know if I do sometimes. So I'm wondering if it's similar to your story, but that's crazy that pregnancy changed it too.
Oh yeah. I knew this was a possibility, right? Before I got pregnant, my endo told me this, there's a chance that your thyroid's going to bounce back and you're not going to need meds, but there's also a chance that this is going to happen. And so I, mentally was preparing myself for that, but nonetheless, when, you get any form of life-changing diagnosis or just a change in your regimen, it's not great, but not here nor there. I mean, I guess things could be worse, and I'm thankful that a pill a day is what helps me manage my thyroid issues, because type 1 is a whole different ballgame.
It is. I talked to my doctor about that, about the connection between the two, and she said there's no known connection of getting hypothyroidism first and then type 1. It's usually the opposite. So usually you get type 1 first and then like hypothyroidism will come. So I'm like, there's got it, but now you're another person who had the same story. So I'm like, it has to be both ways.
Right. And I'll be honest, I'm not, an expert in this field, so I don't know the specifics. I do know, however, that the ADA actually in January, which was Thyroid Awareness Month, the American Diabetes Association, where I used to work, they actually posted about how, because there's such a strong connection, that they encourage anyone with type 1 diabetes to have their thyroid tested at least once a year. So, I can echo that through and through, because like I said, I think that the two are connected. I also have, again, no family history of either. So it's really interesting to me how, I lived with a working pancreas up to almost 25 or 26 years, and then it checked out. So you never know. You just stay on top of it for sure. And I encourage folks to definitely get their thyroid checked regularly.
Yeah. And so were you pregnant before being diagnosed or after?
After.
Okay. So how was that process?
So, it's interesting too, because I actually went to the primary care to test my thyroid and make sure that if there were any changes prior to my husband and I trying to conceive, that I at least had like 6 months of, changing that regimen or dosage of Synthroid if we needed to. And at that appointment, we're just having a checkup basically on my thyroid. That's when I was diagnosed with type 1. And it all came as a huge shock to me. I mean, I'll be honest, I wasn't aware of the signs of type 1 diabetes. I just thought I was really thirsty and I was killing my bride-to-be diet. And I just, I was very, very ignorant, to be honest, to what the signs were of type 1. And I just remember at that appointment, I said, I'm having these crazy nightmares. Like, they are vivid. There's something out of a horror movie. I'm terrified. And I actually was misdiagnosed with an anxiety disorder, which we later found out after my labs were drawn that same appointment. We found out 48 hours later or so that I did not have an anxiety disorder. It's actually because my blood sugars were at 400 and 500 all night. So it was a very interesting first year, because I was diagnosed in May. We got married in August and we knew we wanted to start a family rather immediately. And I conceived in October. So when I was diagnosed, my A1C was 15.5 in May of 2021. And in October, it was down to 6.3 when I got the green light from my endo to have a baby. So it was quite, what was that? 6 months, 8 months, something in there. It was crazy.
Wow. Well, good for you for managing it that well, that quickly. I was gonna say, how was your doctor? Were they like super supportive educational wise?
So this is an interesting question because I feel like yes and no. For example, when I got pregnant, a lot of the information that I was provided by my endocrinologist was more or less related to gestational. And gestational diabetes is very different than type 1, right? So I felt like there could have been more, there could have been more resources, there could have been more education, things of that nature to support me as I was navigating, right? I'm a newly diagnosed diabetic. I'm still trying to figure out the ropes, right? And then now you throw in a growing baby and, in the second trimester, you've got the insulin resistance coming on. And by the third trimester, I mean, the insulin resistance is through the roof. And it's just, I was learning so much already. And then the pregnancy really complicated that. But it was manageable. I will say though, it takes a lot of self-advocacy and, wanting to learn and wanting to research and do all that on your own, because there were some holes in resources for sure.
I can't imagine. It's hard enough as it is doing it, just figuring out the disease and then throwing a pregnancy in the mix. Oh my gosh. So which trimester would you say was like the hardest for you?
The third, hands down, because not only is insulin resistance crazy, let me put into perspective for you. Prior to being pregnant, my basal insulin, so my long-lasting insulin, was 17 units of Tresiba a day. When I leveled out at the end of my third trimester, I was taking 47 units of Tresiba a day. I was flying through pens. It was crazy. And that was sometimes changing daily or weekly. So it's like, oh, 38 units worked yesterday. Oh, but today I need 40. Like it was wild. The first trimester, of course, you're dealing with like being super fatigued and super nauseous, and that was never great. But diabetes wise, the third trimester, I mean, I don't even know. Like those last few weeks, I think are just a blur.
Oh my gosh. Yeah, I can't imagine. And I've heard that before about the changes, but it's like, I don't know. I can't picture it because I haven't experienced it yet, but I'm like, I can't imagine having to change that much. Like, were you scared? Like, I feel like I would have been nervous to give that much because you're
Oh,
not
yes.
used to it.
Yes, yes. And connectively too, the insulin to carb ratio changes significantly. And I want to say I started at 1 to 15 and I ended at 1 to 4. Like it's a puzzle. It's a puzzle. And every day was a puzzle, really. But I do want to say as well that it is manageable. And like the moment that you deliver your baby and they're laid on your chest, it's like every trial and triumph along the way with type 1 is so worth it, because I've mentioned this on my podcast too, but there is just no motivation, like unlike feeling life in your belly. Like I can't even explain it. Some days I'm like, oh yeah, I'll bolus after I eat, or I'll correct later. And it's like when you know that that baby is developing off of your system, it's like that's all that matters. So it is manageable, and you do find this like new motivation within yourself to do better and make better choices. And it's not instinctive, but it really does come naturally when you find out you're pregnant.
Did you still eat pretty much anything you wanted, or did you try to follow a lower carb diet?
So interesting enough, in the resources that I was provided by my endo, you don't want to have like 3 meals a day. They want you to eat more like 4 to 6 kind of, I don't know, I call them snacks, but like they're smaller portions, but it's really to keep your blood sugar more level. But at every single time you eat throughout the day, those 4 to 6 times, they want you to have carbs in there because carbs are essential for the fetus to develop. So no, I did not eat low carb. In fact, I would crave cinnamon rolls, which were so crazy on my blood sugar. So I did try to lean away from those, but I would still treat myself, with the pregnancy cravings and stuff.
That's amazing. That's good to know. I like to hear that.
Yes. I was like, 9 months is going to be a long time.
Yeah, I can't imagine having to do low carb for that long anyway.
Right.
So were you and are you on a pump right now?
I am, yes. So for the first year and 10 months, of having type 1 diabetes, I use strictly MDI, multiple daily injections. However, after I had my son in June of 2022 through March of this year, 2023, I found myself, I don't want to say neglecting my management, but it just got harder, right? Because I have a baby on my hip, but I'm trying to do injections, but then also I'll bolus for a snack or a meal, and then something comes up and, baby needs me and I can't eat. And it was just like, it was difficult. So I reached out to my endo and I said, I really want to try a pump. And I actually decided to choose Omnipod 5 because it was tubeless. Like that was the holy grail for me and my option because of having a baby who is now almost a toddler in less than a month. I can't believe it. So the tubeless option was great for me. And I love the Omnipod and Dexcom duo. It's been life-changing.
That's awesome. I love it. So on the pregnancy though, you were on MDI.
Yes. Correct. The entire time.
Was that challenging at all for you?
So yes and no. Yes, in the fact that, okay, it made it really difficult to exercise, right? Because with MDI, like if you're going to exercise, you need to reduce in the morning. And so that aspect of it was super challenging. However, I did like that, I had control over it. And it wasn't like, for example, sometimes like my Omnipod will just crap out like in the middle of the night and I will have to get up and change it, right? For whatever reason it ends or it runs out of insulin, blah, blah, blah. And I felt like with MDI, it was more controllable in the sense that I wasn't relying on technology as much. So I could manipulate, like everything. And there's a learning curve with a pump too. And I did, mention to my endo when I first got pregnant, probably within the first 3 months or so, maybe first 6 months, I said to him, I really think like a pump may help me. And he said, that is definitely something we can consider, but after you deliver, because the learning curve with it is so significant that now is not the time for, us to experiment. So I do think though, that when baby 2 comes down the road, not right now, I would definitely like to experience pregnancy with a pump for sure.
That's good to know.
Yes,
Any
indeed.
advice that you'd give to somebody wanting to start a family that lives with type 1?
Yes, indeed. First and foremost, I definitely think giving yourself a strong starting point is very helpful. I worked very closely with my endo to make sure that my A1C was in the green light range, right? For us to conceive, because there's just so many more things that come, with pregnancy when you're high risk. So just knowing that I had a good starting point was very helpful. The next thing I would say is do your own research and be your own self-advocate. Because, for example, when I was pregnant, like most other type 1 diabetic moms, we have to see maternal fetal medicine. And the specific doctor that I was seeing at the MFM office was not very familiar with Tresiba. And she did not want me to take Tresiba. She wanted me to go for a more conventional insulin that's been around for a long time. And I said, but Tresiba is fine for me. It's keeping my numbers right where, we want them. And she said, there's not enough research on it. Like, we don't know what that's going to do to the size of the baby. We don't know this, we don't know that. But my endo said, no, I've had many patients, take Tresiba while they're pregnant. I approve. And so I ran like in a roadblock here because it was like one provider is telling me one thing and the next provider is telling me another thing. And I just had to do my own research. And MFM did not like it when I put my foot down, but Tresiba was absolutely great, for me during my pregnancy and thereafter until I got a pump. So I think that being a self-advocate and researching and knowing what you want, and what you want for not only yourself, but your baby is important. So definitely those two things for sure.
Yeah, absolutely. Similar to like the pump, I don't know why they'd want to switch an insulin that you're used to. Like that even seems crazy a little bit.
It was, and it was because I think, what she was used to, it's, was what she was comfortable with, but it's not a one size fits all with type 1 diabetes. And everybody is different. Everybody's bodies are different. They react different to, different insulins, for example, or different diets. And I was like, what's working for me is working for me. Why would we change a system that's not broken? So it just, again, I created some I rocked the boat a little bit with that one, but you know what? My baby, he was born, let's see, I was induced at 38 weeks, but he was born without any complications of my type 1 diabetes. He could regulate his own blood sugars. He was a healthy birth weight. I mean, it was just exactly what I would have wanted. And I'm just so glad that I did not give in to the system that doesn't know me, right, and my specific needs. So
Did your blood sugars change at all after pregnancy with postpartum?
significantly. In fact, my endocrinologist told me you're likely to experience something called postpartum phenomenon. And I'm like, what is this? Is my pancreas coming back forever? And no, not exactly. But he did say for, up to 2 weeks after you deliver, it almost is as if your pancreas is working. And it was so interesting to me. Like after I delivered my son, I vividly remember I didn't have to bolus for food. For like at least a few days. I don't know, maybe like 5 or so. And then it slowly crept back, right? And then it dropped a little bit. I want to say like 11 weeks postpartum, like I needed less insulin. And then it started creeping back up to normal needs pre-pregnancy. But nonetheless, it was quite an experience. It was amazing. I was like, wow, I miss my pancreas so much.
It's like a little teaser that will
Right.
never come to fruition. Are you nervous at all about your son getting type 1 diabetes?
Absolutely. Absolutely. Yeah. I think about it a lot. In fact, if I'm being transparent, I may think about it too much, right? Like from day to day, I'm like, oh my gosh, are you having like, the normal amount of wet diapers? Are you drinking more water today? He's gaining weight, right? And just about every checkup I mention, are we going to check his A1C? And the doctor says, not right now. I guess something or another about how babies, the first like 3 to 6 months of life, I believe they make their own blood. So their A1C is actually not accurate. So she said we were going to wait to, check that. But oh yeah, I'm constantly, having my eyes peeled, looking for the signs and just trying to be aware.
Well, the good news is, according to statistics, you're technically like it's on the lower end because you're a female and you were diagnosed as an adult.
Yes.
So that's good. That's good.
Right. I recently actually posted this on my Instagram at the diabetes diary, but I did research with the American Diabetes Association around the connection between genetics and type 1 diabetes. And believe it or not, those who are in my case, who had a baby over the age of 20, and have like no family history of it, whatnot, it's a 1 in 100 chance. So I will take that. But nonetheless, I do. Yeah, I am worried about him getting it, but I also see it as how amazing that I could show him the ropes if he does have type 1 someday, because I mean, I live with it and, I know it in and out, and I feel like I could be a good role model for him. So we'll take it as it comes.
The best caregiver for sure. Out of like where we had to figure it out ourselves, you'd at least be there for him.
Exactly, for sure.
So what do you think the future of diabetes looks like?
This is a great question. I think that, let's say first, we can only hope for a cure, right? In our lifetime. That would be amazing. I do think, though, that technology is going to continue to just take over diabetes care. And I think that's amazing. I do. I also, would love to see more expansion and access to this great technology, because there are a lot of people who cannot afford CGMs. And someone asked me the other day, if you could live without a CGM or a pump, which one would you pick? And I said, I would live without a pump. Like no questions asked. I have had a CGM since I was diagnosed. Originally, I was on the Freestyle Libre, and then now I have Dexcom. And it has been so vital in my management that I can't imagine not having it, and I would just love to see with the future of diabetes that more people who live with this disease have access to these life-changing technologies, because they really are significant in our management.
Yeah, thank God for CGMs. I completely agree. So how do people get in touch with you?
So I would say first and foremost, Instagram would probably be the best way. That's at the.diabetes diary. I also have an email address linked to me in my link tree. And then also I have a podcast as well, which I know we can't necessarily connect through there, but that's also called the Diabetes Diary, available where you can find most podcasts. So I'm definitely available, and if people have any questions or want additional support, for example, when you're going through pregnancy, it's kind of nice to connect with other people who've gone through pregnancy with type 1 diabetes. And that was something that I really wanted when I was going through my journey. So I'm happy to be that resource for others.
Awesome. Well, thank you so much for being here.
Yes, of course. Thank you so much for having me. I've enjoyed it.